Hi, Aileen here. I just got done being interviewed for the online International Breast Cancer Recovery Summit that's being hosted by Denise Stewart in Australia. And we had a really good conversation today. She was interviewing me about my Cancer Harbors program and how I am working to get it out there to caregivers and patients, and also to physicians and healthcare providers. Because what I do will help the patient and caregiver as a unit with the patient's recovery and improving their health behaviors and reducing risk both of cancer recurrence and of other chronic health conditions. However, I am really struggling with getting it out there to physicians. I really would like to get physicians to recommend this to their patients. And there have been a number of barriers that I've found to using my program. And some of them I anticipated, but others I hadn't anticipated to such an extent. One of the things, first of all, cost. It's not an expensive program. It's only $20 a month, or $220 a year, which is really very inexpensive. And when you consider the fact that right now, patients, when they get their treatment or their aftercare in a cancer center, they are being charged facility fees to the tune of $200 to $400 just to walk in the building. It doesn't provide any extra value. It's just that their oncologist is in that building owned by a big hospital, and the hospital can charge a facility fee. Well, if they had my program for a year, that would be about the same as a facility fee for a 15-minute appointment. So when we're talking about value, I think there's kind of a disconnect there. So that's one of the things that's been a barrier. Also, trying to get the word out to physicians. It's really hard to get in and get the physicians to listen to you. It's almost impossible. I mean, I've really had to struggle. And the few who have given me the time of day, I really appreciate it. Because when they hear about what I'm doing, it makes sense to them. They understand that not only does it help the patient, but it also helps the physician. Because I can field a lot of the questions that they don't really have time to talk about in the appointment. And I can also direct the patient to the appropriate provider or service or whatever it is that they need, whether it's information or services, just whatever it is to help them feel better, to improve their function and improve their quality of life. So those are some of the struggles I've had. And just really thinking about, this is about teamwork. It's about working for the patient. We all have to come together and work as a team. So the physician and any other healthcare providers, the patient, the caregiver, we need to think about them as a unit. Nurses, any therapists or complementary providers, and then, of course, the administrators and the executives, who we really need to bring into the conversation. We really do need to make some major changes in healthcare because we need to get back to teamwork. We need to start teamwork because it really wasn't there in the first place. We've been kind of working in our own silos, as we've been talking about for a while, but it really does affect the outcome for the patient. And we need to work on the relationship between the patient and the provider because that is where good healthcare comes from. That's where the good outcomes come from. When you have trust and you have the ability to sit down and really listen to your patient, know what is important to them, what are their goals, and how can you tailor your care to what they need so that you can maximize their quality of life. So we need to do that. And, it's not a transaction. It's not where the patient is coming in to buy a product because healthcare is not a product. It is a service. and it is something that makes a huge difference in a person's quality of life. So anyway, that's where I'm going with this. I'm trying to get it out there and get physicians to listen to me and realize that, yes, this is something that can help them. And I'm not criticizing the physicians because they do have a crazy amount of work and they're not happy. They're having to do all this documentation and deal with all this paperwork, and the insurance companies are dictating what they can do, and the executives of these big healthcare organizations that they work for are dictating what they can do. And it's not fun for them, and it's not why they went into medicine. So they're not happy. But what I'm saying is that I can make their life a little bit easier. I just need them to give me 10 minutes just to listen to me. So those are the things I'm struggling with Cancer Harbors. Other than that, I'm really enjoying what I'm doing. I love teaching my Fierce class, which is a cancer support group and activity group that I teach twice a month here locally. And I've learned a lot from talking to different support groups and continuing reaching out into the community. That's been great. I've made some progress locally. I've got a nonprofit organization who is offering my services for their post-treatment clients. And that's where I am with Cancer Harbors. I'm just plugging away one day at a time, and going to put out a book this coming year. So there will be a non-online option for people. And I've got other things going too. Really trying to work on the educational aspect of this, looking at presenting this as prehabilitation to educate people before they need it. Because people think cancer is something that's not going to happen to them, when, like in all likelihood, it will happen to them or someone very close to them. Because between a third and a half of us are supposed to get cancer at some point in our lives, according to current statistics. So why not educate people before they have to interact with the healthcare system, so that when they have this serious diagnosis, they have some skills and tools to work with instead of having a complete crisis. That's what's going on. I promised I would give you this update, and so there it is. Thanks for listening. Bye.